Health anxiety has specific vulnerabilities, and there are things that can keep health anxiety going. Hi, this is Jim Brillon. Welcome to this YouTube channel where we discuss all things mental health. The topic today is health anxiety. Health anxiety is something that people used to think of as hypochondria. This is when a person has excessive worries about having or getting some form of serious illness, and it becomes a real preoccupation for them. This looks very much like OCD or Obsessive-compulsive Disorder because there are obsessions and there are compulsions. People might have thoughts and images that go through their mind that cause excessive anxiety that's out of proportion with the actual likelihood of contracting some kind of disease. They might repeatedly check their body for signs of illness, hoping that they can catch it early. And they're not reassured by negative test results or by doctors that tell them that nothing's wrong. And they really have a hard time taking their mind off of their health. It really affects how you think, how you feel, and how you act. Health anxiety has specific vulnerabilities, and there are specific triggers as well. So when we think of vulnerabilities to developing health anxiety, they range from personality traits. If somebody is naturally more anxious than other people, also life experiences that affect your beliefs, your attitudes, your behaviors. It could be that you were sick as a child and you just assume that you're kind of a sick person. You might have had a parent who was overprotective or coddling, and maybe their anxiety contributed to your developing anxiety about this. Another vulnerability for health anxiety is how you respond to health concerns and your sense of physically how strong you are and what kind of mental images you have about your health and your constitution, so to speak, and your beliefs and your attitudes about illness, health, and death. Triggers for somebody with health anxiety are things like proximity to things that you find threatening, being around blood or being around food that has spoiled, proximity to physical or mental illness if you're around other people who are physically ill or mentally ill. Another trigger can be those intrusive memories, those intrusive images, or even learning about an illness. Often somebody with health anxiety, they'll learn about some illness and then they will just dive into a rabbit hole on the internet learning everything about it, and then they start to think that I've got it. Another trigger is the death or illness of a person who's close to you, a loved one who's either passed away or gone through some kind of an illness, and that's in proximity to you. Changes in appearance can be a trigger. If you notice swelling or a rash somewhere or moles on your body, and especially if they start to change, that can be a real trigger for somebody with health anxiety. Any kind of change in functioning, your energy level starts to decrease, or you're having problems with memory. Maybe you're a little more clumsy on certain days, and then your mind starts to think, why am I so clumsy? What's wrong with me? And then you start looking up reasons on the internet why that might happen. And there are things that can keep health anxiety going. Some of the things that can keep health anxiety going are interpreting triggers as a threat. When you perceive any of these changes as a threat, that's how this is perpetuated. Being on the lookout, checking for symptoms, that actually perpetuates the problem. Much like in treating traditional OCD, the more the person checks the doorknob or checks the oven or opens and closes the doors, they actually trust themselves less, not more. So that compulsion actually reinforces their OCD. Intrusive images about illness and death can keep it going, and safety behaviors and avoidance, meaning that if you start avoiding certain situations or certain people, you start not going outside to protect yourself. A lot of times people with health anxiety will have lots and lots of medical consultations. They might be talking with their doctor or different healthcare professionals repeatedly. It's sort of like you have your doctor on speed dial. And they often seek reassurance a lot. There actually is treatment for health anxiety, much the way that we would treat other anxiety disorders. CBT, cognitive behavioral therapy, and ACT, acceptance and commitment therapy, can be highly effective. It involves working out what's really important to you, what really matters to you, sort of getting in touch with your values. And practicing mindfulness can be very helpful, recognizing the difference between getting all caught up in my thoughts and noticing that I have thoughts and I don't need to listen to every thought that I have. Cognitive diffusion to help people become unhooked from your worries and your anxieties, and sometimes medication can be helpful. Medications for anxiety and depression, although there's not a specific medication to treat health anxiety. So like I say, this is very closely related to OCD, and that often co-occurs with health anxiety. And one of the essential elements of it is the person's real struggle with certainty or uncertainty. That's one of the cores of obsessive-compulsive disorder and health anxiety. I hope the videos are helpful, and I encourage you to like and subscribe. Sign up for notifications so we can let you know when more material is coming out. Feel free to post comments in the comments section, ask questions, and I love reading your comments, and I do respond to them. So until next time, take care of yourselves. Bye-bye.